This Advanced Biostructural Correction.
That's correct.
Tell me a little bit more about how that differs from chiropractor that we may see in every strip mall.
So, advanced biostructure, I'm going to preface that with a little story. I was in practice for 15 years. I got into chiropractic because when I was a teenager, I did a lot of bicycle riding and racing, and a friend of mine was a chiropractor, and I was born with a defective heart valve and was told to stop sports at 15. When I was 27, I had open heart surgery, and I was like, oh, I'm going to live now. So what do I want to do? My brother-in-law is a chiropractor, and talking to him, thinking about Dr. Bob, that was a friend when I was a kid, etc. I thought, well, chiropractors have figured out how to fix things in bodies that other people haven't. And I thought, I know how to fix bicycles. This sounds like it's that equivalent to fixing people. That sounds great to me because I like to fix things. So off I went to chiropractic school. And while I've helped many people along the way in the first 15 years of my practice, it wasn't consistent and predictable. There were too many competing ideas about how the body works for me. And I was getting frustrated. And so I was actually thinking about doing something else and getting out of practice. And just then, I was invited to a webinar where I learned about meninges and meningeal release, and that led me to Advanced Biostructural Correction. And so I started, I got all the materials I could get my hands on, and I started working with the technique, started going to seminars, and it changed my life physically, and it certainly, changed my practice dramatically, because now I know exactly what I'm doing and exactly why I'm doing it in a way that I can literally see the results on every patient, and the patient can experience the results. A lot of times you go to the doctor, any doctor, and they say, well, you got to take this, or you got to do this, and it's based on this idea, blah, blah, blah. And that's all fine. But as the patient, you're just going down this path believing that, it's a good idea. With Advanced Biostructural Correction, when I'm working with somebody, they're experiencing it. When I talk to people about shoes and simple changes to the shoes to make them more stable, they don't have to, they don't have to live off the idea that it makes me more stable. They actually feel it. They feel their bodies straighten up and posture improve immediately when I work with them, and they feel the shoes either support them in that or make them wobbly or slumpy. Right then and there. So that's hugely different about it. What's also different is half of it's what we don't do. We don't move bones in directions that the body can already move them if it needs to.